Hello and welcome to my presentation on nursing retention. My name is Paige Conant. Our objectives: students will learn about current issues aiding in nurses leaving their jobs. Students will review peer-reviewed literature discussing nursing retention, and students will be challenged with 3 discussion questions. So I want to start out by talking about the dream. Think about when you decided to become a nurse. Wasn't it exciting? Wasn't it all you could think about? I knew that I wanted to become a nurse ever since I was 8 years old. Caring for others gave me an overwhelming sense of joy, and I knew that it was my calling. So why then, after almost 3 years of being an acute care floor nurse, don't I feel that joy anymore? I walk into work and I feel stressed and overwhelmed before I even clock in, and I leave feeling exhausted. Why am I feeling that when this was my dream? So why are nurses leaving? Staffing is a huge issue. Inadequate staffing leaves nurses burdened with increased patient loads, more responsibilities, and less resources. Who wants to work when they know that no one's supporting them? Scheduling issues, making nurses work outside the shift they were hired for and making them work more hours than they're used to make up for the staffing holes. And bullying, it causes tension and a negative work environment. So when you add these 3 things together, what's left is a really negative work environment. So why would anybody want to continue this? Why would anybody choose to work in this environment? Literature supports that magnet-designated hospitals retain nurses more often than non-magnet hospitals. This research article found that sufficient staffing correlates directly to safer care and better patient outcomes. So if our goal is to improve patient outcomes, we need to have the staff to support that. This article also found that nursing satisfaction is huge, and there's environmental factors that uphold nursing satisfaction. This includes safe, effective patient care, good relationships with coworkers and patients, opportunity for professional growth, overall support for nurses, recognition programs, strong leadership, collaboration between nurses and physicians, and nurse autonomy. Nurse retention, they also found that when you don't retain your nurses and you need to replace them, that can cost about $64,000. That's a lot of money that the hospital could be saving. A second article I found talked about retention of the seasoned nurse and how we need to keep those experienced nurses because of their expertise, their knowledge, and their clinical judgment. There's more novice nurses at the bedside than ever, and without those experienced nurses to help foster the novice nurses' expertise, it's a huge issue, and it's imperative that nursing leaders need to address this. So we're going to watch a video on one lady's thoughts of how to retain nurses.
Nurses want work-life balance. That doesn't surprise you, does it? Nurses have always started training in hospitals. Even though the healthcare system is changing rapidly to out-of-hospital care, the skills and expertise developed there are still valuable in most settings. 60% of nurses work in hospitals, though 85% are employed there within the first year and a half of their first jobs. 26%, though, left their first job within 3 years or so, and over 50% within 6 years. But the majority have chosen another hospital job. Typically, nurses are looking for a better fit with their clinical interests, a healthier work environment. But equally and probably more important now, they're looking for work-life balance.
So that's her take on trying to foster nurse retention and how to keep nurses. And one of the key words she said was a healthy work environment. So in conclusion, environmental factors are key to retaining nurses. If nurses aren't satisfied in their current position, they're going to look outside of their current job, and they're going to look for something less stressful, less tense, with more support and more resources. Nurse managers need to be aware of the issues going on, and they must find ways to promote a healthy environment. If they see bullying, they need to stop it. If there's staffing issues, they need to jump in and help. So nurses really need to foster that healthy environment that nurses are seeking. And if you personally are feeling worn out, you need to talk to your nursing leaders about this. If we're not having open dialogue about these issues, they're never going to be fixed. So it's our job to speak out about what's making us leave, and only then can we truly fix it. So my discussion questions for you are: what specific issues are you struggling with at your current job? Do you feel comfortable speaking to your nurse manager about these issues? And what solutions do you have, and are they realistic? Here's my resources, and thank you for listening.